I'm Dr. Zaidi. I'm an endocrinologist, and I've seen a lot of patients with overactive thyroid or hyperthyroidism and Graves' disease over the years. And today I'm going to share with you my own strategy how to treat hyperthyroidism and Graves' disease. So question number one you should always ask, do you really have Graves' disease? And sometimes you may be told that you have Graves' disease and you actually may not have Graves' disease. And I've seen these kind of cases in my practice. Just a couple of months ago, there was this gentleman who was diagnosed with quote-unquote Graves' disease, and he was given a prescription for tapazole or methimazole, generic name, and he was about to go on that medicine, and one of his friends told me to consult me, and he came to see me, and when I tested him properly, as it turned out, he did not have Graves' disease. So number one thing, you have to be sure that you have Graves' disease. Now, there are many causes for overactive thyroid gland, and or we also call it hyperthyroidism. And Graves' disease is just one of the causes. There are many other causes, and one of the causes is what we call subacute thyroiditis, and this is what this gentleman had. In subacute thyroiditis, what you have is a transient hyperthyroidism which lasts just about 8 to 12 weeks, and later on it spontaneously resolves, complete recovery. It doesn't need any specific treatment. Another cause for overactive thyroid or hyperthyroidism is a nodule in your thyroid gland which is overactive and producing too much thyroid hormone. So that gives rise to overactive thyroid. Another cause for hyperthyroidism is postpartum thyroiditis, which develops after the delivery of a baby. And again, it's a transient hyperthyroidism which lasts only about 8 to 12 weeks, and later on there is a spontaneous recovery, and you don't need any specific treatment for this hyperthyroidism. Okay, so in order to establish a diagnosis, a firm diagnosis of Graves' disease, you really need to see an endocrinologist, okay? And so there are certain tests that you need to have, and one of the commonly used tests, which is basically a screening test, is to check your level of thyroid hormone in the blood, which is your checking your free T3, checking your free T4, and checking your TSH. Now TSH is not your thyroid hormone. Some people confuse it with that. TSH stands for thyroid stimulating hormone. It is produced by the pituitary gland in your brain in response to the level of your thyroid hormone. So if your thyroid hormone, which is free T3 and free T4, if your thyroid hormone level is low, your TSH goes up, and vice versa. If your thyroid hormone, free T3 and free T4, if they are high, then your TSH goes down. So typically in hyperthyroidism, your free T4 and free T3 are going to be elevated, and in response to that, your TSH produced by the pituitary gland is going to be low. So that's a very basic, very screening type test for hyperthyroidism. It doesn't establish the cause of your hyperthyroidism, okay? So once on this blood test you've been found to have hyperthyroidism, then the next step is to find out what is causing it. And there you need the expertise of an endocrinologist. And typically what we do, we're gonna, in addition to doing a good physical examination and looking into your history, we also order some more specific tests such as thyroid antibodies. And because Graves' disease is an autoimmune disease and thyroid antibodies are elevated. And now some of the other conditions that I mentioned, Sometime we need specific test for that, which is usually a thyroid scan. It's a radioactive nuclear medicine scan of your thyroid. No, it will clearly help to differentiate between Graves' disease and subacute thyroiditis. So, once you have clearly established a diagnosis of Graves' disease, then the next step is how to treat it. And I'll go through what is the traditional approach, what are your options, what are the drawbacks with the traditional approach, and what is my approach. So first let's discuss what are your options in the traditional approach. You have three options. Number one, radioactive iodine, that they give you a dose of radioactive iodine, and it pretty much kills your thyroid gland. It will control your hyperthyroidism, but in the vast majority of patients that I've seen, like over 90% of patients, they end up developing underactive thyroid or hypothyroidism, which is permanent. It is lifelong. Okay, so you take care of one disease and you give rise to another disease. In my opinion, it's not a very satisfactory treatment. In addition, radioactive iodine can cause some other problems as well. A lot of patients with Graves' disease also have eye disease. Their eyes are bulging out, they have inflammation. If you give radioactive iodine to these patients, they are at high risk for worsening of this eye disease. It's very troublesome when you have that eye disease. Sometimes patients develop eye disease for the first time after they have received radioactive iodine. Another problem with radioactive iodine, sometimes it can damage your salivary glands here, and then you have a dry mouth, which can be permanent. And another big question that has been floating around for a long time, that does radioactive iodine cause cancer or not? And there is plenty of evidence to convince me that radioactive iodine does cause increased risk for cancer. And I have given reference to that in my book. So you have one choice, which is radioactive iodine, which is frequently employed, especially in the US. Your second choice is giving you anti-thyroid drugs for 18 months to 24 months, and then stop them and see what happens. So again, these drugs usually are in the US. Those are two drugs. One is called methimazole. It comes with the brand name of Tapazole, and the other drug is called PTU. Either one of these drugs will control your hyperthyroidism, but each one of them has very serious, potential serious side effects. Those are rare, but they can happen, and those are pretty serious. And those are primarily two. One is liver injury. These drugs can cause toxicity to your liver. And the other one is they can wipe out your white cell count, and you are at high risk for having life-threatening infections. So these are two rare but serious side effects from these drugs. And what happens if you treat for 24 months and then stop it? So typically in the studies, there are about 40 to 50% chance that after they stop your anti-thyroid drug after 2 years, you will continue to be normal, and there is a 50% chance that your hyperthyroidism will recur after you stop these medications. So your third option is surgery, which will again cure your hyperthyroidism, but in most cases will give rise to permanent hypothyroidism or underactive thyroid for the rest of your life, and you will have to take some medications for the rest of your life. At the same time, surgery poses its own risk of general anesthesia, and sometimes there can be injury to a nerve here is called recurrent laryngeal nerve, and develop hoarseness of voice for the rest of your life. And here's the biggest problem I see with any one of these three strategies, and that is none of these strategies, whether that is radioactive iodine, anti-thyroid drugs for 2 years, or surgery, none of them takes care of the root cause of your Graves' disease, which is autoimmune dysfunction. So, in my opinion, it's a very superficial approach. So about 15 years ago, I looked at it myself and came up with a treatment strategy which is different from the traditional approach, and I put that into practice in my patients, and I've seen some amazing results, and I'm going to share the highlights of that strategy with you now. Before we can treat Graves' disease, we have to look at what really causes it, right? So Graves' disease is an autoimmune dysfunction. What is an autoimmune dysfunction? It's as if your own immune system has gone haywire. Normally your immune system is there to help you, to protect you against bacterial infection, viral infection. But what happens with autoimmune dysfunction, that your own immune system gets hyperactive and start attacking your own glands. And when it start attacking your thyroid gland, we call it autoimmune thyroid disease, which can be of two types. If your antibodies that your immune system is producing, it causes hyperthyroidism, then we call it Graves' disease. Sometimes your immune system produces antibodies which makes your thyroid gland to become underactive. Then we call it Hashimoto's thyroiditis. So actually Hashimoto's thyroiditis and Graves' disease are two manifestations of autoimmune dysfunction, autoimmune thyroid disease. One causing underactive thyroid and the other is overactive thyroid. So let's come back to Graves' disease. So when you're having autoimmune dysfunction, you are at risk for having other manifestations of autoimmune dysfunction as well, not only just thyroid disease. So you are at high risk for having, for example, vitamin B12 deficiency, rheumatoid arthritis, type 1 diabetes, lupus, MS, and there's a long list of autoimmune dysfunction. So that's why we have to treat the root cause, the autoimmune dysfunction, in order to have a comprehensive treatment for your Graves' disease. So obviously the next question is what causes autoimmune dysfunction? And this is my own insight. So number one cause for autoimmune dysfunction is genetic predisposition, and it's very well known, but obviously there is nothing we can do about it. And then there are three other factors which I call modifiable risk factors that we can do something about it, and those are: number one, stress of daily living. That's the number one. I've seen consistently in every patient who have autoimmune dysfunction, Graves' disease, one of the manifestations, they worry a lot, and it's their type of personality as if. So they have a personality that they worry a lot. Over little thing, they just worry a lot. Number two, vitamin D deficiency. And number three, diet. We are eating pretty unhealthy diet these days. And some people can cope with that, and some people who are genetically predisposed to autoimmune dysfunction cannot cope with this unhealthy diet that we are eating these days. So my treatment strategy consists of 3 components. Number 1, manage stress of daily living, especially worrying, anxiety. And here's a catch-22. These patients have a worrying type personality to start with, and once they develop hyperthyroidism, which itself gives rise to anxiety, palpitation, nervousness. So now they worry even more, and that worsens their disease. So it's a vicious cycle. Worrying causing autoimmune dysfunction, Graves' disease, and then Graves' disease worsening anxiety. You understand this vicious cycle? Okay. Number 2, I employ high dose of vitamin D. Your small doses like 600 units a day or 2000 units a day don't work when it comes to curing your autoimmune dysfunction. You have to take high doses, but at the same time you have to be monitored that you don't become toxic. And number 3, I have developed my own diet, and it is not just a simple gluten-free diet. Yeah, that helps, but it does not get to the roots. It does not completely cures your autoimmune dysfunction, and sometimes it can be unhealthy diet. So I have a comprehensive diet, and with people with autoimmune dysfunction, yeah, they have to be gluten-free, but there's more to it than just gluten-free. Okay, so I have put this strategy into my clinical practice, and over the last 15 years I've seen some amazing results, and in almost every one of my Graves' disease patient this strategy has worked. And I've written a book based on my strategy, and this is called Graves' disease and hyperthyroidism. Thank you for listening.